and said, this isn't going to work. Well, why not? Well, it's just not getting better. I've taken the pills, and it's just not making any improvement. He comes in. His eye is all red and angry, okay? And the doctor asked, well, what's going on? Why is your eye looking worse than it was yesterday? Well, I don't know, but those pills hurt. Hurt? The guy had been crushing up the pills and putting them in his eye instead of swallowing them, okay? And my professor said, no, you're supposed to swallow the pills. And the guy said, well, how's something I put in my mouth supposed to help my eye? Well, the point is, the eyeballs are still connected to the body. We still have the same blood flow, so any disease that affects the body, any medications you take, still can affect the eyes. They are not an isolated part of your body, okay? Most common health problems that affect the eyes, diabetes and high blood pressure are big ones, and they're getting bigger, okay? They do have a direct effect on the eyes. I have found several patients with multiple sclerosis that we've discovered it through their eye exam. Stroke, all kinds of things can happen, and we can spot it through the eyes, okay? And we already mentioned medications. So, diabetes. Some of the earliest signs of diabetes are detectable through the eye, and the reason why is the blood vessels in your body are one of the first structures to be affected by high elevated blood sugar, okay? What happens is the vessel walls start to weaken and they start to leak a little bit, and that's what causes neuropathy, the tingling, and sometimes the amputations that have to happen with extreme diabetes. But the eyeball is the only place in the body that you can look directly at a blood vessel without cutting something open. And so when we look at those blood vessels, very often we can identify if a patient has diabetes or if they've got out of control diabetes if they've already been diagnosed. Sometimes the first sign is blurry vision. We often have patients coming in thinking that they need a pair of glasses, and we find out, hey, you've got diabetes that's out of control. We need to correct that before we wind up putting you in some glasses. The danger of ignoring that sort of thing is it can cause some scarring, and you'll see in the next picture. By the way, I do have some eyeball pictures. If anybody's squeamish, you're welcome to close your eyes or look away. They're nothing dramatic. And a lot of the treatments for diabetes are very similar to the treatments for macular degeneration. We'll cover those when we get to the macular degeneration slide. So this is a picture of a normal retina versus a diabetic retina. Very obviously different. What's going on here, this bright yellowish thing is the optic nerve. It's essentially a part of the brain. And you can see all these blood vessels that you don't have to cut anything open in order to see. And you can see over here we've got a whole bunch of leaks happening in those blood vessels. All this yellowish stuff is blood that has been reabsorbed but left behind some metabolism side effects. And this area where you see that yellow deposit is the macula. This is considered your central vision. Okay, and you could see how those deposits, if they're staying in your central vision, could potentially cause some permanent damage to your vision. Now, this is an extremely sick eye. We don't see this kind of thing very often, but you can still get less complication with permanent results. So it's very important if you have diabetes to get your eyes checked at least annually. If you're having problems like this, you're probably going to be seen every 2 to 3 months and monitored for any progress for better or worse. Macular degeneration is one of the things I get the most common questions about. It is a hereditary condition, and so the reason why people ask me is grandma had it or my uncle has it, and I'm concerned that I may be getting it. It is absolutely hereditary. Usually you're not going to see any signs of it before your 60s unless it's an extremely aggressive form, and it can happen before your 60s for sure. But typically not until after that, and for that reason they often call it age-related macular degeneration. There are some studies that indicate that it is exacerbated or brought on by ultraviolet exposure or smoking. Those are the two largest predisposing factors. Unfortunately, the ultraviolet exposure that seems to make the most difference is the ultraviolet that you absorb between ages 0 and 30. So by the time that you're actually concerned about macular degeneration, it's too late. Although it has been shown that wearing sunglasses can help reduce progress or that degeneration. The big thing that's difficult with macular degeneration is you lose that central vision. Okay, so like I said before, in the macula, this spot right here, that's the spot of your retina that you use when you focus on something. So when you're looking at my laser light up there, you're using that very central point. Okay, and when macular degeneration happens, you wind up with an accumulation of stuff right on that central point. Okay, these are byproducts of living. Okay, these are lipids and metabolites that wind up just staying and getting stuck in the tissues of the retina, and you can see how it distorts things. It does cause blindness when it's in its extreme form. This person has a central blind spot, so when they look at your face, they wouldn't be able to see any of your features. They probably would recognize you, and you might find that they even would look off to the side because their peripheral vision is still quite good. But that central vision is damaged to the point that they probably are not seeing faces at this point. Okay? There are some treatments for macular degeneration. It is considered an incurable condition still, but there is a lot of progress being made on how to treat it. If it gets to a very aggressive point, they actually do have a medication that right now is only injectable. So yes, eyeball injections are a real thing, and they're really not as bad as they sound. And for some people, it's a last hope for their vision. However, there is that same medication being moved into an eye drop form, and they're hoping to get FDA approval within the next couple of years. And that would be a very dramatic thing because in the state of Utah, only a surgeon can do an eyeball injection, but eye drops can be prescribed by any eye care physician, such as myself, without any need for surgery. There has also been a study that has shown the reversal of macular degeneration for the first time. So there is hope that someday it will be a curable condition. If you're concerned about macular degeneration, so far the only prevention that they've really been able to identify, or the only help they've been able to identify, are vitamin supplements. And there are specific ingredients that help with that. They are lutein and zeaxanthin. If you get a vitamin supplement, it will brag about having the eye supplements in it. So you don't have to remember what they're called, but they will label it as an eye supplement. Okay. Glaucoma is another one that is pretty familiar to a lot of people. Glaucoma is a condition where the nerve, that optic nerve, that part of the brain actually winds up degenerating. And there are a lot of possible reasons why it's being caused. They're not entirely sure about all of them, but there's one particular feature that they do know, and it's being caused by eye pressure. So the higher the pressure of the inside of your eye, those of you who've been to an eye doctor and had that puff test, it's checking how much pressure there is inside your eye, and we're trying to prevent or at least predict this condition. So if that pressure gets too high, it actually squishes those nerves. It's kind of like stepping on a garden hose, and it pinches off the flow. And anytime in the body you pinch off flow, you wind up with cell death. Okay? Glaucoma is a tough one because it is also not curable. It's very easily treated, but impossible to reverse because once a nerve dies in the body, it does not regenerate. It's also a tough one because you don't really get symptoms. You don't feel it. You don't see it. Essentially what happens is instead of macular degeneration where it goes from the center out, glaucoma is from the periphery in. And usually you don't get symptoms until it starts to cut off your peripheral vision enough that you're noticing kind of a tunnel vision type syndrome. And that's essentially too late. But like I said, it is very, very easy to treat. It's just an eye drop at bedtime that lowers your eye pressure and keeps those nerves healthy. The only way to know for sure if you have glaucoma is to get an eye exam. If you have it in your family history, it's really important to get eye exams annually. It can happen at any age. We picture a lot of eye diseases happening only in our later years, but glaucoma I mean, there are babies that are born with glaucoma conditions, so that's something definitely worth checking into, especially if you've got a strong family history. So like I said, it's a nerve condition. This is a normal nerve. This bright reflection is actually a hole that goes through the center of that nerve so that these blood vessels can come out. And this orange tissue right here is actually the nervous tissue, okay? And you can see on the glaucoma one that nervous tissue is thinned out quite a bit, and that hole through the center has gotten larger. And that's because those nerve tissues are actually dying, okay? Cataracts are a really common condition. In fact, it's so common that anything that has eyeballs can get cataracts. Fish, birds, dogs, cats, humans, doesn't matter, okay? It is not really a disease. It doesn't mean that there's anything wrong with you or that you're unhealthy. It's just that you have eyeballs and they're starting to change, okay? They don't always develop with age. Again, some children are born with cataracts, and it is the leading cause of preventable blindness worldwide. It is not in America because we've got such a great surgery for it and we've got medical care so readily available. And cataract surgery is one of the most amazing developments of well, it's been around for a very long time, but within the last 20 to 25 years, it has been refined to an art. And even 5 years ago, people who had cataract surgery would have a different experience if they were to have it today. You only get cataract surgery once, so there's really no way to compare except through the studies and being able to see the results. One of the coolest things about cataract surgery is they actually can correct your vision while they do it. So those that are interested in LASIK and things like that, cataract surgery is equivalent, if not superior, in correcting your vision over LASIK. The procedure is 10 minutes or less, and you walk out under your own power. You don't drive away because they do give you a sedative while you're having the surgery. So if you need cataract surgery, you should take somebody with you. But it is a painless, very easy, very quick procedure. So you can see here the difference, that lens that I talked about that can focus and change between distance and near. As that lens ages, it starts to harden and it doesn't change focus anymore, which is when we start to push our reading further and further away, or wind up needing reading glasses or bifocals. And as it hardens, you'll start to get cloudy too. Okay, and it's kind of like a windshield that starts to get cracks and chips and deposits on it. And the only way to clear that up is to replace it like a windshield, okay? It can cause a lot of light scatter. That's what this diagram's trying to depict, which will cause glare. Oncoming headlights while driving at night causing glare is usually the first symptom that my patients with cataracts complain about. Another one is they have a hard time reading unless they've got a really bright light focused on what they're reading. You do not typically see a cataract when you look right at somebody unless it's really extreme. And if it's really extreme, they're probably blind from that cataract already. Again, totally preventable blindness. We can fix it up. We just need to get rid of that cataract. Retinal detachments are one of the scarier things that can happen to the eye. They don't hurt. You just lose vision. The hallmark signs of a retinal detachment are flashes of light that seem to come from nowhere or from inside your eye, and a whole lot of floaters. Now, most people will have floaters of some kind. When you have a retinal detachment, it's kind of like somebody just shook up a snow globe and you've got all these floaters going around. Floaters themselves are harmless. They're just little protein fibers that float around on the inside of your eye and cast a shadow. When you get that snow globe sensation, that's a big warning sign that you need to get your eyes checked. Again, they can be really subtle in their early stages. I've found several retinal detachments that the patient had no idea and no symptoms. They were just found during a routine exam. But if you don't fix them, then that whole retina can come off, and it can take just a matter of minutes for it to actually come off. So having a retinal detachment fixed is really important. Even if the whole retina comes off, it can be repaired. I had a patient in Memphis when I was going to school that had been hit in the head doing a in a construction project. And he went blind in one eye, and he felt like it was just a concussion, that it would come back if he rested and took a break. 2 months later, he comes in because he's still not seeing. That retina was so shriveled that it was not savable. But if he had come in that same day or that next day, we could have put that retina back on and he would have been seeing again. So if you get those symptoms, it's really important. Morning, night, doesn't matter. Weekend, weekday, give somebody a call, make sure you get your eyes checked. The biggest risk factors are high nearsightedness, injury, or what's called a PVD. Essentially, there's a water balloon inside your eye that breaks down. It's what creates those floaters. And as that water balloon starts to break down, it can actually pull the retina off with it, which is why if you get that big increase in floaters, it's really important to let somebody know. If you get a retinal detachment in one eye, you have a really high chance of getting a retinal detachment in the other one. So it's really important if you've had a retinal detachment or a family history of retinal detachments to get checked fairly regularly and make sure that that's not happening to you. These are some really cool pictures. This is actually an in-progress retinal detachment. This one, you can see there's a big tear right here, and it's actually peeled off. This is what we call the high water mark, where the retina is still attached, but there's fluid underneath this part of the retina. And you can see the fluid starting to build under this one. This is that macula, and you can see that the high water mark kind of follows a line like this. And so that macula has already come off, so this person is really not seeing well. But that, again, is very fixable. So come on in, have things checked, and we'll make sure we get you fixed up. How are we on time? Are we doing okay on time? Okay. Keratoconus is a condition where the front surface of the eye, the cornea, bulges a little bit. Most cases are hereditary. Sometimes it can be a very aggressive hereditary gene. It usually shows up in mid to late teens, and it affects more men than women. This degeneration causes kind of a bulge to happen on that cornea. Now, the reason why that's important is, again, I'll go to the windshield metaphor. If you had a big bulge in your windshield, you can imagine how that would distort what you're seeing, okay? Same thing happens with keratoconus. The trouble is, if you've got that big bulge, you put glasses on top of it, it doesn't change that bulge is still there. So you're still going to get that distortion. There is a procedure called corneal cross-linking, which can reduce that degeneration. It actually makes the tissue of that cornea harden up, so it bulges less. One of the best corrections for keratoconus is a rigid contact lens. I have a lot of patients that are seeing 20/20 now because they have rigid contact lenses, but without that, if they're in glasses, they're legally blind. So contacts actually have a really important place in eye care. They're more than just a cosmetic thing. With keratoconus, transplants are often necessary, especially if it gets super aggressive. So this is one that's important to stay on top of as well. And you can see this eye on the left has a fairly round front surface, whereas this one on the right has kind of a big bulge right in the center, and that bulge is going to create a lot of distortion in their vision that just cannot be corrected with glasses. One of the most common things I see in the office are contact lens related problems. Overuse, misuse, not knowing how to use contacts are a really common thing. They can cause a lot of complications, the most serious of which is an infection. There are tons of different things out in the universe that want to chew on your eyeball. And when you put on a contact lens, especially a contaminated one, you give them that opportunity. Any infection, any parasite, sounds disgusting, but it happens. Things like that cause scarring on the surface of the eye can damage vision potentially permanently. So if you wear contact lenses, it's actually extremely important to make sure that you handle them the right way. When used the right way, they oftentimes can give you better vision than glasses can. I have down here my little quote here: sleeping, swimming, saving, and saliva. Those are the biggest risk factors to contact lenses. Sleeping in contacts creates what's called an anaerobic environment where there's not oxygen. Most of the complications you get from contacts come from sleeping in them. So depriving the eye of oxygen weakens the tissue, and it actually is a very favorable environment for an awful lot of bacteria. Bacteria don't necessarily like oxygen, so when you sleep in that contact, you're essentially turning your eyeball into a petri dish and can get a pretty serious infection. So there are contacts that are designed for overnight use. I still always recommend to my patients you take them out and you clean them. You wouldn't leave your socks or underwear on for a month without removing them and cleaning them. Why would you do that to your eyeballs? Okay? The next risk factor, swimming. There are actually parasites in swimming pools that cause a lot of infections. Some of them very serious. I have 2 patients that are each blind in one eye because they swam in their contacts and then reused those contacts. Saving contact lenses, using them for longer than they're supposed to, keeping them for 10 years just in case you need them later. That kind of stuff, once a lens has been used, it begins to be contaminated. Even if you don't use it, if you keep it on the shelf for 10 years, contacts have expiration dates just like milk, okay? Sure, they're sterile when they're first packaged, but they do degenerate and they do break down, and you can actually wind up with some pretty serious problems by trying to save a contact lens for later. It's not worth it. Don't gamble. The $100 you save by using your contacts for 2 months instead of 1 over a year is not worth the $200 bill it's going to cost to get your eye fixed up if you get an infection. So replacing your contact lenses properly is a big thing. And I say saliva. Back in the old days with hard lenses, people used to take them out, or if they fell out, they'd spit on them to wash them off and get them rehydrated and stuff. Unfortunately, that is a habit that has carried over into soft lenses. With hard lenses, it wasn't as big a deal, but with soft lenses, they're made out of a spongy material that soaks up anything that it touches. So you've got bacteria in your mouth that's not supposed to be on your eye. You put your contact in your mouth, you're going to get that bacteria in your eye. But it's not just saliva that's the problem. Mostly this note is meant to remind me and my patients, you have to store a contact lens in the proper solution. Tap water is not okay. Filtered drinking water is not okay. It has to be contact lens solution or your risk for infection skyrockets. These are just some pictures of people with contact lens problems. This white spot right here is what's called an ulcer. There's a ton of bacteria in that. And the whiteness comes from white blood cells coming. It's your immune system attacking that bacteria. This is called acanthamoeba. It's caused by a bacteria that is in swimming pools. That's exactly the condition that blinded my patients in those eyes because they reused their contact lenses. Last one I want to talk about is pink eye. It's extremely common. A lot of people are really nervous about it. It's really not a huge deal, but it is a little uncomfortable, and it can be extremely contagious. But it's not going to damage your vision. Nobody's going to go blind from pink eye unless it's a bacterial form that they don't treat. But there are a lot of different kinds, and they're all treated differently. The most famous kind of pink eye, the kind that you're supposed to keep your kids home from school for, is caused by a virus, a lot like a cold virus. The tough thing about that is there's really no treatment for a virus except time. You gotta just give it time and let it pass. It is super contagious because it causes the eyes to water. Those tears are contaminated by that virus. You wipe your eye with your hand, you dry it off on a towel, somebody else uses the towel, and then boom, they've got it. So it's just very, very contagious. Bacterial infections can cause a pink eye, but they're not nearly as contagious. You have to have direct contact with that in order to contract bacterial. So sharing a pillow or sharing a towel would do that, but usually shaking hands with somebody that's got a bacterial infection is not enough to communicate it, unless you both shake hands and then rub your eyes. That could definitely do it. Bacterial is treated by antibiotic eye drops. Very easy to handle, usually resolves in a couple of days. The viral kind can take up to 2 weeks to resolve, but usually not that long. The most common form of pink eye in our area is actually allergic pink eye. It's not contagious at all, but very often people are getting kept home from school because they have an allergic pink eye, and the only thing that's resolving that by waiting is the allergen passes and the eye waters and flushes it out enough. There are allergy eye drops available that are over the counter that I really like, and they do an excellent job. Sometimes it wouldn't hurt just to go pick up that over-the-counter allergy drop, put it in. If things feel better, there's a good chance that you don't have a contagious form of pink eye. That being said, if you're not sure, it's always better to be safe than sorry. And then there's also contact lens related pink eye. If you are a contact lens wearer and your eye starts to go pink, it's often the solution that you're storing it in. Maybe you saved your solution, kind of like saving your bath water, and it got to a point where it's not keeping you clean anymore. It's actually making things worse. So always flush out your solution from your case, use new solution, and you should be safe from that kind of thing. Every once in a while, we develop an allergy to our contact lens solution. Changing brands usually fixes that. And here are some examples. Bacterial pink eye, you definitely know what's happening because you get all sorts of gook in your lashes. It's really gross, really disgusting, but very, very easy to fix. The viral pink eye, like I said, the most well-known form of pink eye, very contagious. And an allergic pink eye, you'll get some, if it's really aggressive, you'll get some swelling and some bubbling of the tissue there. Usually the forms that we see here look an awful lot like the viral form. So it's going to be hard to tell without taking a look at you under a microscope. But then once we get you under a microscope, it's really easy to tell the difference. And then another thing we see pretty often in our office are foreign bodies. This is something that we encounter a ton in the workplace. The most common foreign body is usually metal. What happens is if you're grinding or if you hammer a nail and you've seen those sparks fly off, one of those sparks will hit you in the eye, and it's actually hot enough that it cooks the tissue of the eye just a little bit. So the nice thing is when it cooks it, it gets tough like a steak, and it doesn't actually penetrate. So one of the big fears people have is, oh, a hot spark went to my eye, did it go inside? Usually not. Usually when it cooks that meat, it just stops right there. The best prevention is wearing safety glasses, but I can't tell you how many times I've got somebody that comes in and they said, I was wearing safety glasses, how did this happen? Well, bad luck. It can happen quite a bit. Left untreated, a foreign body, whether it's metal, wood, whatever, can cause infections, inflammations, irritation. It's very painful. You've got more pain nerves on the surface of your eye, density-wise, than anywhere else in your body. So it's very, very easy to tell if you've got something in your eye. And there's just a picture of a little metallic foreign body that got in somebody's eye, and it's already started to rust. So this one's been in there for about 2 or 3 days. That rust can cause a lot of inflammation. You can't just wait for it to grow out. You have to get it removed, otherwise the eye turns all angry and red, and you have to get some more aggressive medication on there to resolve that. That's just kind of a quick overview of all the major things that I see, but again, the list is endless. There is a ton of stuff that can go wrong with the eye. It's important, if you've never had an eye exam, at least to get checked, because 98% of eye conditions you can't feel and you can't see. And a lot of them can cause some serious damage if they're left untreated. So I typically recommend for my patients coming in every year if you've got the insurance benefit for it. Every 2 years if you're perfectly healthy and don't need glasses. Come back every year if you do have an eye condition, or if you need a prescription eyewear correction, because that'll change from year to year as well. That pretty well. Oh, and people often ask, when are you old enough to get an eye exam? The American Optometric Association recommends an eye exam at 6 months old. That's often done by pediatricians, just to make sure that there are no structural problems, no tumors, no cataracts, no things right off the bat. And then I typically see people the first time at age 3 before they start a preschool of some kind, and then again at age 5 before they start kindergarten. Every year after that if they've got a vision problem, every 2 years if everything's perfect. Okay? That summarizes things pretty well. Does anybody have any questions? All right. Well, if questions come up, there's some contact information. I've got a couple cards if you need them, and Be happy to answer questions anytime. Okay, thank you.